In this PowerPoint, we are going to discuss few question and answer about maternity and newborn care. The question answer we have selected in this PowerPoint frequently accessed in NCLEX licensing exam. It is board review question. Question number 1. One day after the child client gives birth, the nurse performs a postpartum assessment, which finding indicate need for further evaluation. So mother is a postpartum, just give a delivery a baby. So in that stage, the comprehensive postpartum visit should include a full assessment of physical, social, and psychological well-being, that including the full, few criteria about the mood, emotion, and well-being. In that stage, we also should care infant care and feeding also should be included. Even in postpartum care, we should educate mother about sexuality, contraception, and also the birth spacing, sleep, and fatigue. So all should be covered. So number 1, a client who has a lochia nigra. Number 2, small clot with mucus. This is normal, nothing abnormal. After the deliveries, blood clot come with mucus. Uterine tenderness, right? Question come, maybe the infection is there, so it is tender. And lochia rubra. So this is lochia rubra, serosa, or elba is normal. So the correct answer is uterine tenderness, right? So Rationale said that uterine tenderness may be the sign of possible infection. So what are the common signs of infection? Fever or high body temperature, redness, swelling, or tenderness. Also, it is a sign of inflammation. Also, that require further evaluate. There is no such thing as lochia nigra. Lochia rubra, the first stage of lochia. So if you ask me, what is lochia? So lochia is the vaginal discharge after the vaginal delivery. It has a stable or musty odor like menstrual discharge. Lochia for the first 3 days after the delivery is dark red in color. A few small blood clot, and it is normal findings, and no longer than a palm, or it should be the normal. So this is the lochia rubra, first stage of lochia, typically lasts for 4 postpartum days. Bright red. It contains a mixture of blood, mucus, and tissue debris. In this table, we can see 3 different types of lochia: rubra, serosa, and elba. Rubra supposed to be bright red, whereas the serosa is pink, elba is creamy yellow. Rubra contain bloody, serosa look like pinkish brown, serous contain. Elba may be brownish. Rubra is when you will call rubra, the first 1 to 3 days postpartum. But 5 to 7 days discharge we call serosa. And 1 to 3 weeks postpartum, we call ELBA. Rubra usually no order or slightly fishy. 4 to 8 pad per day is normal. Serosa, no order, and ELBA, no order or sometimes body order. Next question about the Afghan score. 1 minute after the birth, the neonate has a Afghan score of 7. What should the nurse do? So number 1, admin oxygen via nasal prone to order is ordered. Begin cardiopulmonary resuscitation, shortly called CPR. Number 3, stimulate the breathing by rub the neonate back. Number 4, encourage the mother to hold the neonate close. Correct answer said stimulate breathing by rubbing the neonate back. Afghan score, what is that? So Afghan score, it is the quick test performed on a baby at 1 minute and 5 minutes after the birth. And the 1 minute score determined how well the baby tolerated with the new environment. Usually, Afghan score based on the total score 1 to 10. So the higher score, the better baby is doing after birth. At score 7, 8, or 9 is normal and is a sign that the newborn is the good health. So Afghan score 5 to 7 out of total possible scores 10 indicate mild respiratory depression. To correct the problem, the nurse should stimulate breathing by rubbing the neonate back or by gently but firmly slapping the neonate sole. The nurse should also provide oxygen but should administer it by bag and face masks rather than the nasal prone. The nurse should perform CPR only if the neonate Afghan score between 0 to 2. The neonate must stabilize before being held by the mother. So in this table, we can see the Afghan score. First of all, Afghan stand for A for appearance, G stand for pulse rate, G stand for grimace, A stand for activities, and R for respiratory effort. So here we see there are 5. So if I say what are the 5 components of the score? So the scoring system provided a standardized assessment for infant after delivery. The Afghan score comprises the 5 components like color, right? Heart rate or pulse rate, reflexes, also muscle tone, and respiratory rate. And each of which is given a score 0, 1, and 2. So what are the how does Afghan score calculate? Or if I say Afghan score is 2, what does it mean? So like here, appearance. If the baby's whole body and upper and lower extremities pink, they're supposed to get 2. If the baby is to upper and lower extremities is blue, means less oxygen, but body is the pink color. We get 1 score. But if baby whole body is blue, means cyanosis, less oxygen, they will get 0. Pulse rate. If the pulse rate is more than 100 beat per minute, it is a good sign, baby will get 2. If the heart rate less than 100, baby will get 1. If no pulse rate at all, baby will get 0. Same as if your baby, after the delivery, they cry and pull away, they're supposed to get 2. If baby cry weak, they will get 1. No response to stimuli, they're supposed to get 0. Now, let me tell you the Afghan Score muscle tone. So, activity. If baby active movement, the upper extremity, lower extremity, they're supposed to get 2. Afghan Score 1, if baby's arms and legs is flexed, no movement at all, 0. Respiratory rate or effort, strong cry, they're supposed to get 2. Slow and irregular cry, they're supposed to get 1. No breathing at all, they get 0. So, if I tell you what is a good score for a baby to get on the Afghan test, so what is the normal Afghan score? The score 7 to 10, consider the, you see the normal for the baby, the 1 minute and 5 minute Afghan test. The score is then range usually means that your baby is a good shape and does not need more than routine post-delivery care. So they said 0 to 3 is poor, and 4 to 6 fair, and 7 to 10 is healthy. So here you say, if score is 0 to 3, severely depressed, 4 to 6, moderately depressed, and 7 to 10, excellent condition. So the Apgar is a quick test performed on a baby at 1 and 5 minutes after the birth. Then 1 minute score determine how well the baby tolerates the birthing process. The 5 minute score tell the doctor how well the baby is doing outside the mother uterus. Why Apgar score is important? So Apgar score is important because it identifies the baby's appearance, pulse, agreements, activities, and respiratory following the birth. Using this test, it is possible to check the baby's health and to make sure they do not need any further medical care. Question: which assessment finding is a non-lactating postpartum client require further evaluation? Number 1, progression of lochia from rubra to serosa. Number 2, lack of menses 4 weeks after childbirth. Number 3, return of mens or period within 2 weeks. Number 4, no menstrual cycle 8 weeks after the childbirth. So, examiner asking the question, non-lactating postpartum client required further evaluations. which one is danger, we need to inform the healthcare provider. Number 3, return of means within 2 weeks. Rationale said, in non-lactating client, menstruation typically resume 6 to 10 weeks after childbirth. Progression of lochia from rubra to serosa is a normal findings. So, as a healthcare provider, how we take care of the postpartum care, particularly non-lactating mother, right? How to take care. We educate mother how to take care themselves at home, right? So, postpartum assessment, we should check the breast, uterus, bowel, bladder, lochia, episiotomy, and hormone sign, and also emotional status. Easy way to remember bubble he. B stand for breast, U stand for uterus, B stand for bowel, B stand for bladder, L stand for lochia, E stand for episiotomy, and H stand for hormone sign, and E for emotional status. Now let me explain what we will check in bubble he. So the nurses need to be aware of the normal physiological and psychological change that take place in women's bodies and mind in order to provide comprehensive care during this period. The postpartum period covered the time period from birth until approximately 6 weeks after delivery. So it is important to remember the numerics bubble here to denote the component of postpartum maternal nursing assessment. When you check the bladder, it is courage. It is good to courage for voiding. Check for displaced uterus. Uterus, what will check? Fundus should be found at the level of umbilicus immediately post-delivery. Breast tissue, check for any kind of engorgement. Check for mastitis, and also check for cracked nipple. So it is good to tell, educate mother, avoid, particularly non-lactating, avoid stimulation, wear supporting bra 24 hours, and ice pack or cabbage lips, also mild analgesic for discomfort. When you check the bowel, assess for presence of bowel sound, lochia. If more than 8 pad, AD need to follow up. Episiotomy, like here you can see, this is the birth canal and this is the anus. We do not do the episiotomy to the midline. Midline episiotomy, it is good to avoid the midline. It is good to go lateral side. Any mediolateral episiotomy is good. You see here, during the delivery, if you do not do the episiotomy, the chance to tear and it is extend to the anus, it would be difficult to healing up, right? Although the stretching. So in this picture, we can see the delivery of the head of the baby and extend the birth canal lateral position like this and facilitate the delivery. So when mother do episiotomy, it is not the cesarean section. We will check for redness, any edema, ecchymosis, any kind of discharge, or approximations. After the delivery or cesarean section, mother have to immobilized on the bed. So we need to check any kind of deep vein thrombosis. So we need to check Homan sign. If Homan sign is positive, Homan sign should be absent. If it is positive, it is need to assess the deep vein thrombosis. Here we can say what is Homan sign. Here you see the doctor, one hand support the heel, other hand force placed on the toes of foot. It is called dorsiflexion. If you do this, if patient complain the pain here in the calf muscle, it indicates deep vein thrombosis. So pain elicit from the two maneuver indicate deep vein thrombosis. So here you see, hold it and upward force placed on the calf muscle. So elicitation and response with the knee in the flexed position, forcible dorsiflexion, the ankle. Response pain in the calf with this maneuver is consistent with the deep venous thrombosis. So to elicit the human sign, first support the patient thigh with one hand on his foot with the other. Bend his legs slightly at the knee, then firmly and abruptly dorsiflex. Indicate the positive Homan sign. So the patient may also resist the ankle dorsiflex or flex the knee involuntary if Homan sign positive. So a nurse asks a pregnant client about her alcohol use. The client admits she sometimes has several glasses of wine with a dinner. Her alcohol consumption put her fetus at the risk for which condition? So mother had a habit to intake alcohol during the pregnancy event. Number one, alcohol addiction. Number two, anencephaly. Number three, Down syndrome. And number four, learning disability. The correct answer said learning disabilities. Rationale, maternal alcohol use during the pregnancy may cause fetal and neonate central nervous system deficit, such as learning disabilities. It also may lead to characteristics, physical anomaly, and growth retardation. Maternal alcohol use does not cause alcohol addiction in the fetus or neonate. Anencephaly occurred when the cranial end of the neural tube failed to fuse before 26 days of gestation. And this condition is not related to the maternal alcohol use. Down syndrome results from a chromosomal disorder. If this is the picture, we can see fetal alcohol syndrome characteristics. Like baby boy has a low nasal breath, minor ear abnormalities, microganthria, mandible small, thin upper lips, the flat mid-face and short nose, short palpable fissure, and epicanthus fold. This is the picture we can see Anencephaly, the head is absent. So in this page, we gather what are the other complications possible to the fetus, like fetal alcohol syndrome or called drug addiction. They have maybe the small head, epicanthus fold, flat midline, low nasal bridge, small eye, short nose, and thin upper tips. Facial paralysis means the risks increase with forceps delivery. Cerebral palsy risks include maternal age, low birth weight, and also anorexic episode. Also, erythroblastosis fetalis, it is called RS incompatibilities. If any complication like this, give to rhogram administer at least 28 weeks gestation within 72 hours after birth and avoid voluntary termination of the pregnancies. After spontaneous termination of pregnancy, next, what other congenital anomaly in the infant? Maybe heart disease or spina bifida. So we here in this picture we can see spinal cord. You see, open up. This is the normal spinal cord, and this is called spina bifida occulta, and here is called meningocele. So sometimes baby can develop esophageal atresia. So this is a normal anatomy. It is esophagus and this is the trachea. Esophagus are the part of respiratory. Esophagus is the part of gastrointestinal system, whereas the trachea is the part of respiratory system. If unfortunately these two tracts interact and formation abnormal opening, we called atresia. Atresia with the distal fistula formation. Atresia with the double fistula formation. It is called fistula atresia. And this one is called fistula only. So if baby born with esophageal fistula, maybe they develop coughing, choking, and cyanosis, right? Also, we have to monitor for apnea. Remove the lids when not attached, unplug cord when not plugged into the monitor. Also, electrode at the mid-axillary line, 1 to 2 finger below the nipple.